Hi, and welcome to this week's podcast. My name's Grant Bentley, and today I want to talk about the classification of disease, which may not at first sound a particularly exciting topic, but it's really important for the practitioner to understand, and probably as a potential patient or as a patient to also understand. Now, homeopaths divide the disease into their own classifications. First is acute disease, second is chronic disease, and for those that practice the HFA method like myself, then we also have a further subclassification of non-infectious chronic disease, and I'll just talk about that in a minute. But essentially, an acute disease is any sort of virus or bacteria that enters our system and we become sick because we succumb to it. A bit like either the flu or chickenpox or measles or anything of that sort of nature that has a viral bacterial origin. Then you've got chronic disease. Now, chronic disease can also be classified in two ways, like I was saying before. The first one is that there are some chronic infections, like, for example, tuberculosis or syphilis, AIDS. Then there is another category, which is what we would class as a non-infectious chronic disease. Here you're looking at rheumatoid arthritis or migraines, depression. Chronic because it is ongoing. It starts at a young age, or it can start at any. The timing of the origin doesn't really matter, but it is continuous. That's the point. And it often will keep on increasing in its magnitude as time goes on. So what we're looking at there, though, is that there is not an infectious origin. Now, what makes that important is because of the way that we're going to treat that patient is going to be a little different in our expectation from, say, something that has a viral origin like an acute disease. Because when you're talking about a viral origin, then you're talking about the potential for a cure. But when you're talking about a non-infectious chronic disease, meaning that it's a chronic disease that doesn't have an infectious or bacterial origin, but is more I guess, an outcome of stress or circumstances, life situations that preceded the onset of the signs and symptoms. Now, in cases like that, we're not really looking for cure, but we are looking for balance and we are looking for management. That doesn't mean to say that we can't significantly improve the signs and symptoms that a patient has, but it just means the methodology for the practitioner is a little different, and so too is the expectation. Now, that's really important because if you get that wrong right from the beginning, the expectations are going to be they're going to be incorrect for the situation. And if your expectations and your classification are wrong, then so too can often be the management plan. So this is really point number one, is to understand what classification each patient belongs to when they walk into your clinic. So, for the vast majority of people in the Western world, for example, they will be coming to a homeopath for conditions that would fall into that category of non-infectious chronic diseases. These are behavioral problems, depression, they are things like migraines, arthritis, cancer, so on. So these sort of conditions need to be managed. And if the homeopath doesn't understand this sort of, because most of the literature in homeopathy is all about cure. But what Hahnemann is talking about when he talks about cure is that he's talking about diseases that come from a viral or bacterial origin. Because Hahnemann essentially sees homeopathy as a one-dimensional medical system in its action, meaning that it repels something from the body. So there, in order for any disease to be eradicated, it has to have some sort of viral or bacterial origin, otherwise homeopathy can't push it out of the system. But the thing is that homeopathy, like all energy, works in a multifactorial, a number of ways. And one of those ways is by replenishment. Now, I'll talk about how it works a little more next time, but essentially, anybody that comes into the clinic with a condition that doesn't have a viral origin has what we call a non-infectious chronic disease, or a disease that is a result of lifestyle or stresses that have preceded the onset of signs and symptoms. And one of the easiest ways of knowing that it fits into that category, the disease I'm talking about, is that the patient will say, when they're talking about their condition, that all their signs and symptoms are worse for one or two factors. One is that they are all the conditions. Let's say migraines, for example. The people will often say that their migraines are much worse if they become stressed. So the worse for stress, or the migraines start in clusters, or they get stronger or worse if they are run down, they being the patient that suffers from it. So worse for stress, worse for tiredness or exhaustion. What we're seeing there is that the signs and symptoms are related to energy. And so our job now becomes to replenish and balance out and manage that patient's energy levels, rather than looking for a homeopathic remedy that is a specific simillimum to push something out of the body. That being the case, our management plan alters slightly from the conventional system. But I'll talk about that maybe a little bit more as these podcasts continue. But for now, that's it, and I'll see you later.